for coming out this morning in support of our program this morning. As an extension of our wellness program, City on the Move, we're partnering with the American Heart Association in order to put on a new program called Check, Change, Control. We do have a representative here from American Heart that's going to go over that with us this morning. So again, thank you all for coming. I am wearing red today, a recognition of Heart Health Month. So we know what Heart Health Month is this February. So if you have on your red, if you don't have on red, we have little pins over here that you can put on your lapel to show that you're in support of Heart Health Month. So without further ado, I'm going to turn it over to City Manager Bruce Moore, and he's going to come up. He's going to come up and talk to us for a few moments. Again, thank you for coming. And if you have not signed in, be sure to sign in. That way you can get your C-Help points. Again, if you haven't been out there to C-Help, make sure you do that. Log in. Save your information as you go so you can get credit for everything that you're doing. So again, thank you.
Good morning. Good morning. First of all, I really want to congratulate our Human Resources Department. They have really done just an excellent job in kicking our wellness activities off. So let's give Robin and Rachel and the team It is the mission of the City of Little Rock to promote the health and wellness of our employees through education and initiatives that encourage habits of wellness, increase awareness of factors and resources contributing to well-being, inspire and empower individuals to take responsibility for their own health, support a sense of community, and reduce the occurrences of health-related diseases. As we've talked about our wellness program for the past few months, as we talk about insurance, as a City Hall family, we're really going to emphasize this going forward. So I'm really excited about the components that we've already announced and more to come in the future. So thank you.
Good morning. I decided not to wear red. I decided to wear blue. But I do have the red pins, so make sure you guys wear the little red dress and support heart disease. I have the pleasure of introducing our speaker, Mr. Matthew Stripling. Matthew Stripling is the Central Arkansas Community Impact Director for the American Heart Association. Matthew graduated from the University of Central Arkansas with a bachelor's degree in exercise science and is a certified exercise physiologist through the American College of Sports Medicine. After completing this bachelor's degree, he worked for 5 years with Baptist Health Medical Center in the Cardiac Rehabilitation Department and Chronic Disease. Worked for management. During this time, he completed his master's degree in healthcare administration from Capella University. In 2017, he began working with the AHA soon after. His primary responsibilities are hypertension management through Target BP and Check, Change, Control initiatives, and promoting healthy equity through local health education events. Without further ado, Mr. Matthew Stripling.
Thank you for having us here this morning. At the American Heart Association, our mission, we set a goal back 10 or 20 years ago, and it says by the year 2020, we want to improve the cardiovascular health of all Americans by 20%, while reducing deaths from cardiovascular disease and stroke by 20%. And so that sounds like a very large goal. In setting out to do so, we knew that programs like this were important, and finding employers and folks in the community to work with, like City Hall and the City of Little Rock, were going to be essential for us to hit those goals. In your chair, you'll find this paper right here, and we'll kind of work through it. But this is what we call Life Simple 7. Through years of research and narrowing down what we can do to improve our health, the American Heart Association has come up with Life Simple 7, and it's 7 key characteristics that you can do to improve your health. We know that chronic disease affects millions of Americans. Some we know personally, and it affects 80% of all Americans, but it's our health behaviors that affect our health the most. Just so you know, heart disease and stroke affects my family. I remember back in ninth grade, I went to go visit Gran and Papa in the hospital. They both had cardiovascular bypass surgery, and I didn't know what to do. I walked into a hospital room and saw Gran laying there, and she had tubes everywhere and was hooked up on monitors, and I was taken back. I didn't know what to say. I was scared, I was nervous, I didn't know what was going on. And it kind of led me to this point. It led me to where I'm at right now. That heart disease affects everyone in the family, not just the survivor, not just the parent, not just the grandparent, but the kids as well. And it stuck with me. And so I'm happy to be here today to promote health and well-being through the American Heart Association and talk about these things. So let's dive into it and let's look at these 7 things. And I'll just name them off. The first one is stop smoking, maintain a healthy weight, engage in regular physical activity, eat a healthy diet, manage blood pressure, which we'll get to in depth here in a minute, take charge of your cholesterol, and keep blood sugar or glucose at a healthy level. These 7 things are what you can do to impact your health. A lot of times we talk about genetics and family history, and we can't change those things. You can't change your age. We're all going to get older. We're going to get a little, sickness tends to happen as we get a little older, and you can't really affect your gender, right? So, but these 7 things you can have an influence on. So let's start with get active. Finding time for exercise is so important. The American Heart Association recommends 150 minutes per week of moderate exercise or 75 minutes per week of vigorous exercise. Now that sounds like a lot when you throw it all together, but really 30 minutes a day is what we're looking for. And you can even split that up to 10 minutes 3 times a day. Now, that's manageable. It can be 10 minutes in the morning before work. It could be taking the stairs rather than using the elevator. Maybe 10 minutes at lunch if you go out on a nice day and take a walk. Maybe 10 minutes when you get home. Maybe to walk the dog or kind of walk from with the kids from school. But continuing to walk or get some type of aerobic exercise each day is super, super important. Number 2 is control your cholesterol. And this needs to be done with a physician. If you get your blood work done each year, congratulations, you're doing great. That's fantastic. We encourage regular physician visits each year for that healthy checkup. It really is important to know what those numbers are. A cholesterol level of 200 or higher puts you at a higher risk. So it's important that you get that measurement and do what you need to do to take action. Number 3 is eat better. And for most of us, this is the hardest thing we have to work on. Exercise is great, and it's something simple throughout the day we can do, but that heart healthy decision to make though at lunch and breakfast and dinner is something that we have to constantly work at. And there's a lot of myths and fad diets out there. So we encourage everyone to look at credible sources like the American Heart Association website, where it gives you healthy, science-proven methods of a healthy diet. We recommend the DASH diet, and it focuses on sodium, which sodium has a lot to do with your blood pressure. The normal American gets 72% of their sodium intake without even using the salt shaker at the table. Sodium comes in a lot of our prepackaged meats, our processed foods, cheeses and sauces. So it's important to read those labels and know where that sodium's coming from, especially if you eat fast food quite often or sodas like Cokes and things like that have a lot of sodium in them. And the more sodium that you have, it's just going to drive that blood pressure up, okay? So really watching your sodium, and then also sugar as well. Sugar is just added calories, and it's empty calories. And when we're talking about eating better and exercising and trying to lose weight, it's really best to consume fluids that don't have any calories in them whatsoever. We'll skip blood pressure and go to it last, but weight loss. Among Americans aged 20 and older, 145 million are overweight or obese, and that's a big number. And we know that in Arkansas, over 35% of Americans are obese. And that's a big, big number. And we definitely rank towards the top among the states in that. So what can you do? Definitely a diet is the most important thing when it comes to weight loss. Making sure you know where you need to be in that calorie maintenance, and then also trying to exercise to kind of help you regulate your calorie intake. Find a nutrition plan that works for you. Everybody's different. From the years that I've worked in the hospital, I know that certain diets and certain meal plans work for some people. There's no one size fits all. And so it's really seeing what works best for you and kind of managing that process. Losing a half a pound to a pound a week is fantastic. Especially over like a 6 to 12 or a 3-month period. A lot of people get discouraged when they haven't lost, more than like 30 or 40 pounds. If you're losing a half a pound to a pound a week, you're doing something great. Okay, it's tough. I think besides stopping smoking, for smokers, weight loss is one of the hardest things there is. And so it's important to have a buddy system, or maybe a group of employees at work that you can battle around together to kind of enjoy that journey together. Reducing your blood sugar is the next one. And that's so important because of the link that it has with diabetes. Heart disease and diabetes really go hand in hand. If you have diabetes or pre-diabetes, it's important that you follow up with your physician regularly to know where you're at. If you have a family history of diabetes, it's important to go ahead and follow up with that physician, even if you don't have it now, to know where you're at. So that you can be on the front end of measuring it. And the last one is the impact of smoking on your health. For the public, we all know that smoking and cancer are very closely related, but sometimes a lot of people leave out heart disease. But heart disease is the #1 killer of all Americans. A lot of times cancer gets the big push and a lot of the press, but really heart disease and stroke is what affects most of us. Arkansas ranks #1 of stroke deaths in the country. So really managing your blood pressure, stop smoking, and these life simple 7 things that you can take can really make a big influence on your health. The last one that I want to talk about is your blood pressure. We're happy to work with the City of Little Rock to roll out our check change control program. And really what the science behind it is that if you measure your blood pressure and you know what your numbers are, you're more apt to do something about it. 1/3 of all Americans have high blood pressure. That's 1/3. So if there's 40 people in this room, that's quite a bit. And a lot of people don't think that it's me, and we don't measure our blood pressure as much as we may step on the scale and check our weight. But our blood pressure is really the most important risk factor that you can manage to improve your cardiovascular disease or prevent it. So with our check change control program, what we're going to do is it's a 4-month program, and we're going to ask that you check your blood pressure twice a month. That's all it is. And that you track it and that you log it, and you see how it trends over time. Hopefully that's on a decrease by controlling some of these life simple 7 things. Each month we're going to look and see which departments have the highest employee participation rate, and we're going to hand out incentives each month for those who enroll and get going. They can vary from Fitbits or a spa day for the ladies. So different fun things to kind of keep you engaged and get you going. And then at the very end, the department that has the most participation, or if we have several that get 100%, which we're hoping for, we'll do a drawing, and the American Heart Association will sponsor a free heart healthy lunch and make a big celebration of it. So today what we're going to do is we're going to hand out blood pressure cuffs to all the department managers or their representative because we want to help in this initiative and really show the importance of what managing your blood pressure is. And so each bag, you'll get a blood pressure cuff and then some BP logs that kind of show what that number means, that if you're elevated or if you're at a hypertension 1, 2, or 3. And then also an infographic that shows you how to check your blood pressure correctly. So because checking it is great, but checking it correctly is what we really want to focus on. So at this time, we're going to hand some blood pressure cuffs out, and we're going to start off with, I lost my sheet. with the 14 departments. And we're going to start off with Bruce Moore, the city manager. Thank you, sir. Appreciate it. And then the city attorney's office. We have a representative. Come on down. There you go. Human resources. Thank you, ma'am. IT, information technology, front and center. Sir. Parks and Rec. We will do the planning and development. Thanks. Finance. You're welcome. Fleet services. The police. There you are. Sir. Housing and neighborhood. Public Works. Thank you very much. The zoo, everybody's favorite. District courts. And then, did I leave anyone out? No? Thank you. Fire? Are they in the bottom? They may not be here. Perfect. Okay, at this time I'm going to turn it back over to Robin, and I think she's going to give us some more information.
Okay, again, thank everyone for coming. I hope everyone uses their blood pressure cuff and really get into this program with us. Again, as Matt has already said, I'm not going to try to restate what he said because he knows all about it. But, you know, we're just happy that everyone did take the time out to come, that you're excited about doing this with us. Because, again, as all of us become healthy, that makes us a healthier city, a healthier population. So we really want to get behind it and really push it and do what we can to make this happen. We're going to ask the department directors to give it Rachel at the end, because some of you have divisions within your department that we have asked for cuffs to accommodate those different divisions. So if you're here representing your department, please give it to Rachel, and she's going to give that to you, okay? Thank you. American Heart Association did sponsor breakfast this morning or snacks this morning, so feel free to stop by, pick up some snacks, and thank you again.